Good afternoon, everybody. One more time. Good afternoon. Oh, good. I want to be sure everybody's awake. I want to thank you for joining us here today in Madison as we open our 6th community vaccination site in suburban Cook County. When fully operational, this new site will be able to provide nearly 4,000 vaccines a day. Before I begin, I'd like to recognize those in attendance today. We're going to begin with County Commissioner Donna Miller. We have 2 mayors with us, Mayor Sheila Chalmers of Madison and Mayor Rich Reinbold of Richton Park. We have with us our CEO of the Cook County Health and Hospital System, Israel Rocha. We have Vera Brooks, who represents Representative Debbie Myers-Martin. We have Tony Presta, who represents Congresswoman Robin Kelly. From our health and hospital staff, we have Dr. Kieran Joshi, who is co-lead of our Department of Public Health. We have Dr. Greg Hewen, who's vaccination coordinator for the Cook County Department of Public Health. And, what's your title? General what? Major? Major. All right, I'm promoting you. All right. Major Sanford from the National Guard. We're deeply indebted to the National Guard. We could not do our mass vaccination sites without the men and women of the Guard, so thank you very much. Major Sanford. All right, and I'd like to acknowledge Rachel Kruk, who is our sign language interpreter. A special thank you to our CEO, Israel Rocha, and the other elected officials who are with us today to mark the opening of yet another site to ensure that eligible residents can be vaccinated in the most expeditious manner. I'd like to thank Governor Pritzker, the Illinois National Guard, and all of our staff, of course, as we try to continue to provide vaccinations to people in Cook County. It takes tremendous work to get these sites up and running, and I'm deeply indebted to our Department of Public Health and to all of our staff across the board in helping us do these vaccinations. We also have 100 partners, 100 partner locations for vaccination. We're committed to the equitable distribution of the vaccine. And we know that some communities in the county have been harder hit than others. And we're particularly grateful to have this site in the Southland where we know communities have been heavily impacted. There's no one thing that we're going to do to beat the virus, but we've tried to develop a comprehensive strategy that includes max vaccination sites, target initiatives, and efforts to reach specific communities such as firefighters, teachers, first responders, seniors, and the homebound. We're moving closer to herd immunity, but Dr. Fauci tells us that's about 70% of our population, so we have a ways to go. Our future rests upon the decisions that we make at this critical moment. So even if we've been vaccinated, we have to continue to wash our hands, wear our masks, and practice physical distancing. We hope that we're through the worst of this, but it's up to each of us. It's up to each of us to do our part to put this pandemic behind us. I want to thank you for your support and patience as we work to serve our communities during this critical time. Next, I'd like to bring up our Commissioner of the 6th District, Commissioner Donna Miller.
Thank you so much, Madam President, and good afternoon, everyone.
Good afternoon.
I'm Donna Miller, Cook County Commissioner of the 6th District, and represent this area. So I want to thank President Preckwinkle for inviting us all here today and to talk briefly about the vaccine rollout and to announce this great grand opening of another large community vaccine site right here in Madison in the 6th District. I also want to thank Cook County Health CEO Israel Rocha, as well as the National Guard and all the other elected officials, Mayor Sheila Chalmers, Mayor Rick Reinbold, as well as the other trustees and everyone who's here today, because everyone has been working very hard to make sure that we are working to combat this pandemic. We all know that the South Suburbs has been hit particularly hard by this pandemic, not just from a healthcare standpoint, but also from a business standpoint. In fact, in this district alone in 2020, there were 1,105 deaths. 38% of those were black, and this really shows the inequities due to this terrible disease and the unparalleled level of disparities of healthcare outcomes during COVID-19, especially in the African American and Latinx communities in Cook County. And it's why it's so important to have a vaccination plan, and it is administered in an equitable fashion. Today is more evidence of Cook County's commitment to do just that, and a testament to the leadership at all levels of government, as we see represented here today in our dedication to Cook County and Illinois. So Matheson is an ideal location for a community vaccination site for many reasons, and it's critically important in the Southland, which has some of the longest commute times in the county, including for our health care. We need to keep educating our constituents about the urgency of getting vaccinated. I can't stress the importance of that enough. We need to follow the science and the data has been overwhelmingly positive as it relates to these vaccines. We must ensure as many people get vaccinated as soon as possible, as President Preckwinkle mentioned, to reach herd immunity, but it also helped prevent the virus from mutating so quickly, and we've all heard stories about the mutations in the news. I encourage everyone to get vaccinated when it's their turn. If there's any questions, we have so many healthcare providers and resources to answer those questions, as well as allay any fears you might have about the vaccine. So thank you again. I look forward to continue working with all the leaders of the community and the members here in the South suburbs and beyond to overcome this pandemic and build a better and more equitable future for all of us. Thank you so much.
Next, I'd like to ask the mayor of this community, formerly known as village president, Sheila Chalmers Curran. Where are you? There you are.
Thank you, President Preckwinkle. Thank you all that are here today. This is extremely important that we continue what we've already started with trying to make sure that we get more vaccines in the arms of so many out here. The Southland itself needs this and needs this desperately, and I'm glad that the President recognized this and that we are now moving forward to making sure that we can change the trajectory that has happened so far with this vaccine. I want you to know that everyone here is excited about the idea that this is not only for the village of Matheson, but for the Southland itself, and how much this is going to help individuals in this area. So without saying anything else about this, welcome, welcome, welcome to the village of Matheson, and we look forward to individuals coming here for their vaccines. Thank you.
Thank you. Before we bring up Major Sanford, I'd like to acknowledge Howard Robinson, who is the senior advisor to Senator Michael Hastings, who's in Springfield. Thank you. All right. Major Sanford.
Good afternoon. Thank you, President Preckwinkle, Commissioner Miller, Mayor Chalmers Curran, Dr. Joshi, Mr. Rocha. My name is Major David Sanford, and I am the Task Force 1 officer in charge of the Illinois National Guard, and I represent the nearly 1,500 members of the National Guard, both soldiers and airmen, serving across this great state. It's my pleasure to work alongside the leadership of Cook County and the City of Madison. We, the National Guard, are here to help. We take the direction from the county and the Illinois Departments of Public Health, taking pride in executing the plans and programs directed by those agencies to help the citizens of Illinois. The National Guard has been in the fight against COVID-19 from the beginning, working hand in hand with the Illinois Department of Public Health and the Illinois Emergency Management Agency. From the early days of setting up testing sites to now assisting in the administration of the vaccine, we have used our skills in logistics, planning, and operations to facilitate the state response. We are a cross-section of the Illinois populace. We are your neighbors, co-workers, members of your community. The soldiers and airmen of Illinois National Guard are Illinois. There are more than 24,000 National Guard members currently assisting local authorities in this fight throughout the United States. The National Guard is the oldest component of the United States military, dating back to the first muster of the colonial militia in the Massachusetts Bay Colony on December 13, 1636. Just like then, we are here now to support our nation, our state, our counties, and the great people of Madison and Cook County. Thank you for supporting us, and together we will win this fight. Again, thank you for coming.
Thank you. Thank you. Major. Good. Next, I'd like to hear from Israel Rocha, who's Chief Executive Officer of Cook County Health.
Good afternoon, everybody. Thank you so much for joining us here today as Cook County opens its 6th large-scale vaccination site. This site will officially open at 1 p.m. tomorrow. As always, we want to express our gratitude to Governor Pritzker, President Preckwinkle, the Cook County Board of Commissioners, our local elected officials, and the members of the Illinois National Guard. Their support in getting these sites off the ground has been crucial to ensuring vaccine across the county. These large-scale sites are a model for the country as to how organizations can work together to benefit the communities we live in and the residents that we serve. Thanks to these types of collaborations, Cook County Health has been able to administer nearly 500,000 COVID-19 vaccines since our first shot was administered back in December. I know that today's announcement from the FDA and the CDC has dominated some of our news prior to coming here. It's important to stress that the pause is out of an abundance of caution, and that our federal partners will review the situation thoroughly as quickly as they can. After I will be able to give the comments today, we will also recognize Dr. Kieran Joshi, our Senior Medical Officer from the Department of Health, and Dr. Greg Kuhn, our Infectious Disease Specialist and Vaccine Coordinator for Cook County Health, to have some questions and answers to help you. I do want to be able to share some information that for Cook County Health, pausing our Johnson & Johnson will impact our numbers at a manageable scale. We were set to release about 35,000 appointments today. That has been reduced to about 27,000. Early this morning, as soon as we got news of that, our vaccination team and our safety team and our public health team quickly huddled to be able to make sure that we were able to do what we've always promised, to make sure that our systems and controls were in place and we would rely on science and evidence. As that information came forward, we were able to make the decision to put a pause on our Johnson & Johnson administration at our sites and to make sure to contact all individuals that their appointments would be honored, and we're able to switch to Pfizer and Moderna vaccine for all individuals who had booked an appointment who previously were available to Johnson & Johnson. It's important to cite that this is a step out of abundance of caution and is a commitment to what not only we have made, but the entire process has made to our residents, that as soon as any information were to be given, that we would take steps to make sure and share that information, that science would prevail. And also, while it is concerning to get some of this news and reports, it is also should be a comfort. It lets you know that the process works, that immediately when a few cases were cited, that this administration, its vaccine, and its process is very closely monitored. It is monitored throughout the country at every location and at every site with the best medicine that is to be available and the best processes to monitor. And even at the first symbol of any kind of concern, the FDA and CDC took immediate and decisive action, and that was pursued through all our locations here today to make sure that we are taking every step possible out of abundance of caution to make sure that we are keeping our residents safe, informed, and that the process is moving forward. This week, we have administered approximately 3,000 J&J appointments that will be honored again through Moderna and Pfizer. This site will be a Pfizer site and will have the capacity to do as many as 4,000 vaccines a day. And I'm pleased to report that we have seen a supply increase in recent weeks and are very optimistic that in due time, we will be able to provide everyone with a vaccine who wants one. Again, we want to just make sure that individuals know that we have made significant inroads in vaccinating residents and continue to race against the variants. It is critical that people get vaccinated, that everyone continues to mask up, keep their distance, and wash their hands. You have all heard me say that this is a marathon, not a sprint. We cannot afford to drop the baton in the final leg of the race. We must remain vigilant, and we must look out for all those who are most vulnerable. Talk to your family and friends and neighbors. encourage them to get vaccinated, and remind them to keep masking, keeping their distance, and washing their hands. We all knew when we entered this process that the battle against COVID would not be easy. From the development of vaccines to making sure that we safeguard those that we care about and love, this will be a race, and a race that we must and will win. And today is one more step in this opening, the opening of this center, that makes that another step in the likelihood that we will be successful in that campaign. A healthy Cook County and a healthy Illinois requires all of us to work together. So I thank everyone for their attention. We will be happy to answer more questions if you have them. And now I turn over back to Madam President. Thank you so much.
All right, I'd like to bring up Dr. Kieran Joshi, who's co-lead of the Cook County Department of Public Health.
Thank you, Madam President, Mr. Rocha, elected officials, Mayor. Earlier today, we learned that CDC and FDA began investigating 6 cases of a stroke-like illness resulting from a rare and severe type of blood clot, coupled with a low level of platelets, which are a type of blood cell. This was occurring in individuals who received the Johnson & Johnson vaccine. These 6 cases were identified out of the more than 6.8 million doses. Let me say that again, 6.8 million doses of Johnson & Johnson that have been administered in the U.S. as of just yesterday, April 12th. All 6 cases were among women between the ages of 18 and 48, and symptoms occurred in 6 to 13 days post-vaccination. People who have received the Johnson & Johnson vaccine who develop severe headaches, abdominal pain, leg pain, or shortness of breath within 3 weeks of vaccination should contact their healthcare provider. We're also encouraging all healthcare providers who see patients with these types of blood clots or with low platelets to ask about vaccination, recent vaccination with Johnson & Johnson. As Mr. Rocha mentioned, Cook County Health and CCDPH have paused all use of Johnson & Johnson vaccine at all sites and communicated to all providers in suburban Cook County to do the same. I also want to remind everyone that there are 2 very effective and very safe vaccines, both the Moderna and the Pfizer vaccine, that we continue to administer throughout suburban Cook County. The risks of side effects is far outweighed by the benefits of protecting yourselves, protecting your loved ones, and the most vulnerable among us. So if you haven't already done so, I highly encourage you to go out, sign up, and get your shot. I want to close by saying that the safety of our residents is our highest priority. We will continue to monitor this evolving situation and continue to keep the public informed. Thank you.
Thank you, Dr. Joshi. Okay. Nick, what's the story?
We'll take questions here first, and then we'll go to the calls. Are there any reporters here who have questions?
All right. Dr. Rocha, would you speak to us in Spanish, please?
Mr. Rocha, yes, there we go. Buenas tardes. Gracias por todos acompañarnos aquí hoy con el condado de Cook para abrir el 6º centro de vacuna en esta gran escala. Este sitio abre oficialmente mañana a las 1 de la tarde. Como siempre, quiero expresar mi gratitud al gobernador Pritzker, a la presidente Preckwinkle y a la Junta de Comisionados del condado de Cook. A los electos y también a los electados oficios que están aquí con nosotros y los miembros de la Guardia Nacional de Illinois. Su apoyo para que este sitio habrán sido fundamental garantizar el acceso de las vacunas a través de todo el condado y todos los residentes de nuestra comunidad. Estos sitios de vacunación son un modelo para el país y para todas las comunidades y las organizaciones que pueden trabajar juntas, que podemos hacer cosas juntos para poder beneficiar a las comunidades en todas las comunidades donde vivimos. dispense. Gracias a ese tipo de cooperación con Cook County Health, ha podido administrar casi medio de millón de dosis de vacuna contra el COVID-19 de nuestra primera infección en diciembre. Quiero decir hoy que las noticias que vinieron del FDA y del CDC dominaron las noticias. Es importante enfatizar que la pausa es una acción por precaución. Confirmamos en nuestros socios federales reversan la situación a fondo y tan rápido como pueden. Los doctores, Dr. Hyun y Dr. Joshi, están aquí con nosotros para poder contestar preguntas que tenemos sobre las noticias hoy. Pero es muy importante que hablamos con nosotros y con toda la gente aquí, que aprender de estas noticias, tuvimos acción directa para poder garantizar la salud de todos aquí en nuestra comunidad. Para poder hacer eso, nosotros hemos ponido un pause sobre la vacunación de J&J en nuestros sitios aquí de más vacuna. Y estamos trabajando juntos para poder ganar más información con la CDC y con la FDA. Estamos pensando que esta semana vamos a resucitar los números de vacuna de 27,000. De 35,000 a 27 miles de vacunaciones que vamos a poder dar en este sitio. Ese sitio de vacunación será un sitio para Pfizer y vamos a estar también proviendo la vacunación de Moderna para toda la comunidad. Estamos aquí para poder tener cualquiera preguntas que la comunidad tiene y para poder dar la información que nuestra comunidad necesita. Estamos aquí para también decir que es muy importante que todos ganen la vacuna. La noticia de hoy no va a cambiar la historia, que es muy importante para ganar esta lucha sobre COVID-19. Tenemos que ayudar a toda la familia a poner su máscara, tener su distancia, lavar sus manos y continuar a agarrar la vacuna para poder garantizar la salud a todos los residentes de nuestro condado y también todos los familiares que nosotros queremos. Juntos sí vamos a poder ganar. Y la noticia de hoy puede a veces traer unas dudas y unas preguntas, pero también queremos decir que las acciones que tenemos es la información que ustedes necesitan para poder saber que el gobierno trabajó para garantizar su salud. Estas vacunas están muy dispense las palabras, están mirando muy cerca por el gobierno. Están trabajando para poder mirar cualquier cosa que pasa y inmediatamente tienen acciones para poder garantizar su salud. Estamos juntos, estamos aquí para sus preguntas y estamos juntos para trabajar juntos para poder ganar esta lucha sobre COVID-19. Gracias.
Thank you, Israel. WBEZ, yes? Kristen, are you still with us?
Yes, hi. Good afternoon.
Good afternoon.
I just wanted to start with, we know that most providers have been using Pfizer and Moderna. Those vaccines came out first, there's been a lot more supply of them. But just to understand the impact of hitting pause on the J&J vaccine, can you give me a sense of out of all the vaccinations done at the Cook County mass vaccination site, what percentage of people have received a J&J vaccine?
I'm sorry, just a second. You want to know what percentage of the total number of people we vaccinated got J&J? Is that the question?
Right. So when you think about the impact to the county, I'm wondering, at the suburban mass vaccination site, how many people have received the J&J shot versus Pfizer or Moderna?
Sure.
Just one more question after that.
All right. Israel, answer the first part.
Hi, good afternoon. So I can answer the question. About 5% of residents have received the Johnson & Johnson vaccine from our total dosing program that has been administered on our mass vaccination sites. To give you a scale of the number, we have given over 500,000 doses of vaccine, and of those, 27,000 have been Johnson & Johnson.
All right, what's your second question, Kristen? All right, what is our supply of Pfizer and Moderna to make up for the fact that there's a pause on Johnson & Johnson?
So what I can tell you is that our supply fluctuates. We have enough to be able to meet all of our doses and all the appointments that we have given for this week. And so we are good until Saturday. We are working with the state and local officials to make sure that we have enough vaccine supply. As we said earlier in our statement, anyone that has an appointment that previously was booked with Johnson & Johnson this morning and throughout the day will receive a communication from our Cook County Health website, which is also a testament to its ability to work and to make sure and honor our commitment that we will always inform everybody of that information. They have received information telling them that if they have Johnson & Johnson, that vaccine administration has been paused. We will honor their ability to be able to get a vaccine by making sure that their product will move to either Pfizer or Moderna, depending on the site that they were booked. And so we make sure that we have enough vaccine to honor for the rest of the week. As I said earlier, we reduced the number of first doses from 35,000 to 27,000 to ensure that we would be able to make it through the week. And the reason why I'm not giving a declarative number is that we also have second doses, and I don't have that information in front of me on the total number, but I know that coming into this meeting, we have been able to honor all of our second doses and all of our first doses through the end of this week. Sorry. Sorry.
That's okay. Don't worry.
Thank you.
All right.
Next will be the Chicago Tribune.
Alice?
I don't think it's Alice.
Somebody else, okay. Whoever you are from the Chicago Tribune.
Hi, President Preckwinkle. John Byrne here. How concerned are you that the situation with the J&J vaccine will convince people who maybe been on the fence, have been concerned about getting vaccinated, that they're just now not going to get vaccinated at all because they're worried about what's happening with J&J?
I think, so the question is, what's our response to people who might be worried about being vaccinated because of the CDC pause in distribution of J&J? I think we should go back to the remarks that were made either by Israel or Kieran, Dr. Joshi or Israel Rocha, which is that they're looking into 6 people out of almost 7 million people vaccinated. 6 people, that means 1 chance in a million that you'll have a negative response. I like those odds.
But are you worried, though? I mean, there's some level of reluctance out there, whether it's logical or not. Are you worried that this plays into those fears?
I suppose that's possible, but it's. But I think that I'm hopeful that the CDC will decide that we can continue using the vaccine, given the extraordinarily small pool of people who have possibly had a negative reaction to the vaccine.
And then just to be sure, nobody locally has experienced any of these blood clot problems, to your knowledge?
No local people have, to our knowledge, experienced these problems.
Thank you.
All right, Madam President, we have Crane over there.
Cranes, whoever you are, identify yourself.
Hi, Stephanie Wilbur here. Thanks for taking my question.
I'm sorry, this is whom?
This is Stephanie Wilbur from Crane.
Stephanie, okay.
Thanks. So with Michigan in the midst of a surge, with more cases among young people, I'm wondering if, given that we have similar vaccination rates here and also mitigation, are you expecting a similar surge here? And if yes, what are you doing now to prepare?
What are we doing now to prepare for a surge? Is that what your question is?
So the first part is, are you expecting a surge similar to what Michigan is seeing right now?
Are we expecting a surge? Dr. Joshi is volunteering to answer the question. I am grateful.
Thank you. So first let me say what we know, which is that we have been seeing case counts, case rates, test positivity, and rates of hospitalization increasing over the last few weeks. Now, over the last few days, the last week or so, we have seen a slowing of that increase. So I think that's hopeful. That's a good signal. Second, let me say we can control this. If we continue to follow the good public health guidance that we've been discussing from the very beginning, which I think you all know at this point consists of wearing a mask, washing your hands, watching your distance, and of course being careful with crowds and getting your shot when you're eligible, I think we can bring this pandemic under control. Thank you.
And I'll go ahead and answer your second question of what we're doing to prepare. So Cook County Health, of course, operates Rocha and Provident hospitals as well as all the other hospitals are taking similar measures. It's something that this is now not our first surge, so I can just review the steps that we take. So most facilities are evaluating their staffing. They're increasing their staffing where they can, whether it is bringing in additional staffing resources. I can tell you that both Provident and Stroger Hospital are increasing their nursing complement by utilizing agency and working with IEMA and different agencies to bring in more nursing staff. We're able to monitor and increase our bed units to make sure that we are at full capacity. We are bringing additional intensivists, critical care specialists who will be coming aboard our staff to be able to help, as well as ICU nurses to be able to make sure that we can be able to meet a need should a surge occur. I want to be clear that all these steps are being taken out of abundance of caution and are taken to make sure that we can respond. And so we are increasing our bed count. We're increasing our staffing complement. We're evaluating all the equipment that is necessary to respond to a surge and making sure that we have ample PPE, ample ventilators, ample supply. I want to make sure that as we prepare both questions, the question was asked, should people be concerned? People should be concerned about how we're going to beat COVID together. And we have, as has been said, 2 very, very safe vaccines and a third that is right now just being reviewed. But when we look at the outcomes of a surge, it's also a reminder of why we have to keep our processes. And I will also remind residents that what they can do is that we still have our testing service, our contact trace service. If you have any symptoms, make sure that you take precautions. Make sure you come into your health facilities to be quickly evaluated, to be tested, and to take precautions to slow down the spread of any surge. So again, we are moving forward. We're increasing our bed complement, our staffing complement, and ensuring that we have all the resources to respond to any individual that needs assistance. And we ask residents to do their part as well, to make sure to keep their distance and to make sure they wash their hands and that they come in to be tested should they have any symptoms at all. Thank you so much.
All right, is there anyone else on the line who hasn't been called upon?
Hi, this is Alex Nicken of the Daily Light. Can you hear me?
Yes, Alex.
Hello. So I have a question. I guess this would be for Dr. Joshi. We understand that the county has scheduled some second Pfizer doses using a 4-day grace period. Basically, it keeps saying it can be as little as 17 days or as many as 25 days after the first dose. But the CDC and Pfizer have both said explicitly it really should be 21 days, if possible. They said don't use the 4-day grace period to schedule appointments. So I guess I just want to ask, what would you tell folks who are concerned that being given a 17-day window at a county vaccination site might be, risk sacrificing some of the safety or effectiveness of the Pfizer vaccine?
All right, Dr. Hume gets to speak to this. Did you hear the question?
I did, yes.
All right, good.
Hi, Alex. So with the guidelines now and actually with the clinical trial data, Pfizer is 21 days separated from dose 1 to dose 2. Moderna is 28 days. So our policy actually is to adhere to those intervals between the first dose and the second dose. There are allowances to go 4 days before that 21-day or 28-day interval. We will do that on certain occasions for convenience, but otherwise we will be sticking to the schedule as outlined by the emergency use authorization.
Okay, thank you. And then if I could also just ask Israel Rocha, if Cook County Health has published demographic level data for how many people have been vaccinated through the county, and if not, when that might be published?
Sure. So we have released numbers of individuals that have been vaccinated, and so again today we've said we've given over 500,000 doses. On the demographic data and by zip code, we have released some information, but we'll very hopefully over the next 2 weeks be able to present a more robust process. And again, the real thing that we're trying to do is to make sure that the data is accurate and that it reflects the doses that have been given. And so we're trying to make sure that information is timely. So we're hoping over the next few days to be able to give some more information and clarity on the demographic data of our vaccination program.